The holiday season can be a particularly challenging one for all of us, whether it comes to our relationship with our families, friends, and in the workplace as professionals, and healthcare professionals are no exception. During this time of the year, people typically talk about the importance of boundaries, how to be aware of them, and how to implement them. And I have devoted all of this month on this channel to talk about boundaries as a healthcare professional for yourself. But before we get more into the nitty-gritty aspects of boundaries from last week, I thought let's set some clear definitions and differentiate between what boundaries are and what boundaries aren't, so that you know as a healthcare professional what to work with. Welcome back to my channel, everybody. Thank you very much for joining me as always and for your attention, presence, and engagement. For those who don't know me, my name is Shweta. I am the founder of Healthy Dynamics. We are a coaching practice that helps healthcare professionals from English as a second language backgrounds become better, empathetic, more influential, and impactful communicators and build better relationships with their patients to become a person of excellence in their workplace. So, as I mentioned at the very beginning of the video, all of this month I have been devoting to making videos and posting content on my LinkedIn about boundaries in a more broad sense. And interestingly, one of the podcasts I regularly listen to, which is Child Free Wealth, I'm going to leave the link over here if you want to check that out. And their latest episode as well talked about boundaries, but it was more along the sense of how to uphold them with your family as a child-free person, and especially in the States where all the political drama has been happening recently. So I felt that time and again, this concept of boundaries is coming up very frequently at this time of the year because it is the holiday season. You are going to be meeting with family members that you're going to clash with. And at the same time, in your profession, you might be facing a lot of deadlines and a lot of demands on yourself by your patients and your employers. So I felt that instead of jumping straight into how to effectively set boundaries, that we're going to do with the future, obviously, I would follow on from last week's video, which I'm going to leave here, and do a little bit of a differentiation between what boundaries are and what boundaries aren't. The reason being that we talk about boundaries a lot. It gets thrown around all the time. You go to any social media, they talk about boundaries all the time. But people have a lot of misunderstanding and a lot of misconceptions related to what boundaries actually are. So they don't clearly understand what it is and what it isn't. There's a lot of assumptions about it. So it's a very gray and fluid and murky area. So how I'm going to do this is I'm going to draw this little table. And there's obviously two sections here. There's what boundaries are and what boundaries aren't. And I'm going to add a few points one by one and then give you some examples to support. So let's get straight into it. Number one, boundaries are designed for the purpose of protecting your peace and energy. It is not a way to jeopardize what you're providing to your patient in terms of care, treatment, and support. Now, from the conversation that I've been having with my new followers on LinkedIn, this seems to be a common problem. So what normally happens is that the patients tend to call them during odd hours of the day and night when knowing fully well that you as a healthcare provider are not available during that time to work, or that's just not a time that you could be contacted. And I'm aware that in some situations they might be quite stressed and anxious. So whether you are a therapist and you work with mental health professionals, you can be a midwife who's working with newly expected mothers, and that, which is again is a very challenging time. And also I've observed that sometimes when you have for new mothers who've just had their children, they can be expected. They can expect their pediatricians to be at their beck and call whenever their child gets sick. So in that situation, you're not going to be available to everyone at every single time. So it's more because you want to do a good job of when you are working with your patients, when you are taking appointments and when you are doing consultations. You can't do it 24/7 because you are going to absolutely burn out during that time. So the purpose of setting boundaries is so that you are recharged and you are energized for when you do consult with your patients in person or online. And in order to do that, there's a healthy balance between the time that you are replenishing your energy and balancing your work life versus your non-work life. But it's not really it's not really an indication that you're not going to provide the support and treatment and the care that your patient requires, but it will have to be done at a time when you are available and you are. They need to respect the fact that there are certain times that you cannot be contacted. So that's number one. Number two is boundaries hinge on mutual respect, so they are not a one-way street. Just like you as a healthcare provider are expected to be respectful of your patients, they have to show the same respect to you. So, and it works both ways. You cannot expect someone to respect you if you're not giving them that respect yourself. It is absolutely a give and take scenario. So just like I've done tons of videos, which I'm happy to post here on how to respect your patients and make sure that they respect you. Some examples can be like I've mentioned before, you cannot be judgmental, you cannot gaslight, you can't be manipulative, you can't push your own opinions on a patient because that is a disrespect to them. You also have to do the same thing as a healthcare professional when they are being disrespectful to you. So say for example, so they can be a person a patient of yours who could be name calling you, making racial slurs at you, and really questioning your credibility, but doing so in a not so nice way. It is important for you to speak up for yourself and advocate for yourself for the fact that this is something that you will not put up with and you will not tolerate it, because you're here to help them and support them, but you will only do that if that respect is done mutually. So that's number two. Number three, boundaries make sure that you are creating space for what truly matters. And it is not really a way of saying no to anything and everything according to your whims and fancies. So let's say, for example, you sort of so say for example, you are given a certain role as a healthcare provider. Say for example, you can be a geriatric nurse, for example, and you work with patients who have a very specific condition. So if you're say working with people who have dementia and Alzheimer's, but all of a sudden, what can happen is, especially if you're short-staffed, the organization might throw responsibilities at you and tell you that you have to now go and work with these patients, and you really have had no experience and training in working with patients of that particular condition. So that's why it's important that you come up with a personal boundary plan. Now, I'm going to go into that more into next week. So this boundary plan and the execution of it, it's not really to turn down opportunities. So you obviously, as a healthcare provider, in this case a geriatric nurse, obviously you want to diversify and expand your role and become more, develop yourself more professionally. But at the same time, you have to make space for what truly matters to you and aligns with your personal goals and professional goals and your well-being. You can't be everything to everyone, otherwise you will become nothing to no one. I've mentioned this in videos before. And as I said, setting boundaries is not just about saying no to everything. Don't assume that boundaries are just, the one way that you set boundaries is just you say no to every single thing. It's more about what you are saying yes to that is going to make you a much better healthcare professional. Speaking of which, next week I will be interviewing Susan Murray. That video will be available next week, where she has done an exact framework on how to set boundaries, and she uses that with her clients. Now, if you don't remember Susan, I'm going to link her interview over here. So next week, the interview has been completed. It'll be uploaded next week, where we talk in a lot of detail about boundaries, because her work that she's doing at the moment really talks about boundary setting, what they are, what they aren't, why they're important. She does that work with her clients, and she's also developing a course in relation to that. So make sure that you check that out. But as I said, the interview will be available to be watched next week. So that was number 3. And finally, number 4, boundaries are really the pillar of clear and effective communication. They are not hard and fast rules. So what can happen is when you're setting a boundary, and especially when you're saying no, people think that other people will perceive you as being very cold, distant, unemotional, and like you really don't care about them. But at the same time, you can be kind, but also be very firm in terms of what you can do and what you will do and what you will and won't tolerate. So it's more about you are being very explicit, you're being very direct and being very assertive about what it is that you will, you have the energy and capacity to deal with. And Susan mentions this very well in that interview, which we'll check out next week. So it's not really about enforcing hard and fast rules, nor is it polite requests. So it's not one extreme or the other. They are being very clear as crystal and explicit about what you can provide and what you are not in a position or are unwilling to support, care, and treat your patient or anything along those lines. So that way, when you have that transparency, patients know what to expect, and there's very clear guidelines on what what you'll be giving them, and the trust and everything will actually be built, and they'll be feeling more secure and reassured in the care that they're receiving. So this, in a nutshell, really hopefully has clarified to you what boundaries are and aren't. So as I said, it's a very fluid and vague topic, so hopefully this has made things a bit more clear to you. You will learn more about boundary setting from the perspective of Susan Murray, so please check out, stay tuned for that video. And for being updated for all my other videos, make sure that you hit the subscribe button and the notification bell, and leave a like and comment below if any of this resonated with you. And as always, thank you very much for your time, attention, and presence, and I will see you next week with the lovely Susan Murray.